This patient is about to go under anesthesia for a liver transplant. First, I'm going to attach the blood pressure cuff to the patient. Arm, please. Thank you. Good. And to the patient. And the reading is going to show up on the monitor. And now I'm going to attach the 3 electrodes. One's going to go on the right side, right under the collarbone. The one's going to go on the left side. And then the third one is going to go right in the stomach area. And that will also show on the monitor. I'm now going to place the oxygen tube on the patient so when they're under anesthesia, they will be able to breathe. So I'm going to place this in their nostrils and put it under their ears. I'm now going to tighten the oxygen tube so during surgery it will not come loose. And this will also show on the monitor. Perfect. I'm now going to place the IV, but first I need to find a vein. So I'm going to wrap this around the patient's arm and lightly tap to see if a good vein comes out. I found one in the forearm, so now we can begin.
Oh, go.
I'm now going to clean the site where the IV is going to be placed. Using this in the forearm, I'm going to clean the forearm. As you can see, it is cleaning it. Now that we've fully cleaned the site of the IV, we are going to let it dry for a second. I'm now going to insert the IV. So I'm going to go into the forearm. And lightly slide this out. Now that the catheter is in, I'm going to insert the flush syringe. I'm first going to unhook the safety and screw it. Unscrew the flush syringe and insert it into the catheter. Now to make sure that the blood is not clogged in the catheter, we're going to insert the flush syringe. So as you can see, fluid is coming out just to make sure it's flowing properly. Now I'm going to untwist the fluid syringe and place a lock so that the blood will not escape. This secures the blood to make sure it will not go out of the catheter. I'm going to lock that just to make sure. In the IV site, I'm going to place Zofran, which is for nausea, and Versed to make the patient relax when she's under anesthesia. Yeah. Throughout the patient being under anesthesia, all of the tubes and electrodes that we connected will be showing on the monitor their breathing rates, their blood pressure, and their oxygen levels. The liver transplant is over and the patient is coming up from anesthesia, so now I will ask some general questions to make sure they are intact. Jordan, wake up. It's Nurse Lauren. Hi, how are you doing?
Good.
You're good?
Yeah.
Can I ask you a few questions?
Yeah.
Yeah? Okay, can you raise your hand for me? Good. Can you count how many fingers are on your hand?
1, 2, 3, 4, 5.
Perfect. Can you say your full name for me?
Jordan Ann Naylor.
Perfect. And then what's the date today? Would you know?
September 15th.
Oh, good. Okay. Simple questions to show that the anesthesia weared off and that the patient is lucid and the surgery is a success. Thank you for watching.